Doctors, what are the dead giveaway signs that someone is faking? Whenever the symptoms aren't there when the patient doesn't know they're being watched. I had someone fake a stroke recently and walked in on her walking around her room independently after pretending to be limp on her left side, letting us take complete care of her and wiping her butt for her. It was wild, y'all. Not a doctor, but a paramedic. Tons of calls to the jail for inmates with seizures. I lift the arm over their face and let it go. They'll move it to prevent hitting their face, or I'll lightly brush their eyelashes, and they'll twitch to it. A nurse thought I was faking that I could not swallow when I woke up from jaw surgery. When I came out of the surgery and was panicking, telling them I couldn't swallow my own saliva, the nurse just told me, "Yes, you can. This surgery wouldn't have anything to do with your ability to swallow." I could also barely speak and started crying and pleading with her to believe me. I ended up having cranial nerve damage that paralyzed half of my tongue, trachea, esophagus, and vocal cords. It took 8 months to heal. I drank thickened water, which is as gross as it sounds, for 8 months. Having a healthcare professional not believe you during trauma is absolutely scarring. You can be faking good too. Had a tooth kicked out, mouth filled with blood and swelling. I'd stuck a tissue in to try to stop the blood. I've presented to the triage at the dental hospital. I'm dribbling blood as I talk. She asks me if it hurts, and I said, "A little bit." She looked at me dead in the eye and said, "One of the many things we triage on is pain." Gotcha, good nurse. Hurts like a motherfucker. I've literally been kicked in the face. Thanks for that. Notes taken. Was patched up and out of there within an hour. If someone is unconscious, make a fist and rub your knuckles against their sternum, chest bone. Put some pressure behind it and rub quickly up and down, up towards chin, down towards belly button. It's called a sternal rub and is incredibly painful, but won't harm the person. It's very, very hard to completely ignore and continue with the ruse of faking being unconscious. The only more sure thing is asking your partner to hand you the eye needle, to take some ocular fluid while they're passed out so they won't feel the pain of the needle in their eye. I'm not a physician, but a paramedic. Honestly, I don't really care if you're faking as long as it's halfway believable. I'm still going to treat it as the worst case scenario. Faking a seizure, you'll get a full set of vitals, a blood sugar, and a shot of benzos. There's lots of different types of seizures. If you call 911 because you're in extreme pain and want an ambulance ride, I'll put the good drugs in your vein hole. I'd rather give 100 drug seekers a 100 micrograms of fentanyl than withhold it for the one person that really needs it. Can I tell if someone is faking? Yeah, most times, but it goes both ways. If you go too hard, I might assume you have a legit life-threatening injury and sedate, paralyze, and intubate you. Or start IVs in your jugular or shin bone. Fake it if you want, but traction may vary. Nurse here, I had a teenager overdose on Zoloft and start having strange seizure-like episodes. What made them particularly strange is that they all followed a predictable pattern of onset. First, he would lower the bed. Next, he would turn the TV volume down. And finally, he would check to see if I was nearby. There was pretty severe thrashing about, without any abnormalities in breathing, heart rate, pupils, and he was still able to communicate with me throughout the entire episode. Unsurprisingly, EEG also failed to show any abnormalities. Not a doctor, but a therapist. For some reason, adolescents like faking DID, formerly multiple personality disorder. It's a pretty rare and debated diagnosis in our field. I've seen people fake it by mimicking how it's portrayed in movies and on TV. Red flags are them telling you, "I have multiple personality disorder," and of course, not meeting the actual diagnostic criteria. Some people feel like the common diagnoses aren't big or special enough to accurately represent their struggles, so they cosplay something worse. Whatever you're working through is a big deal to us. If you feel like you have to fake or exaggerate your symptoms for your therapist, consider finding a different therapist. Not a doctor, but I once had a nurse tell me something that stuck with me ever since. I had a gallbladder attack when I was younger, and let me tell you, that's some of the worst pain I've ever felt. I was doubled over, vomiting bile, and unable to move. My mom took me to the ER at 1 a.m. in the middle of a snowstorm. As the nurse was doing my initial evaluation, she asked me the standard on a scale of 1 to 10 pain question. I thought for a couple seconds and told her, 7 or 8. It hurts really, really bad. She nodded knowingly and told me, got it, it hurts really bad. Most people who tell me 10 are lying. No one ever feels a 10. In hindsight, I'm not sure that's the best practice for a nurse. Still, after seeing drug-seeking patients myself, I understand her frustration. They ended up giving me morphine, which brought that number down quite a bit. I have the reverse. My back went out, extreme sciatica pain, like being struck by lightning constantly. Couldn't move for days. When someone found me 3 days later, they called 911, just for the doctor to tell me I was faking it for pain meds. While I was crying in pain, I asked him why I'd lay in a pile of my own piss and shit for 3 days for some Vicodin when I literally own a bar. Fucking insane.